Hello everyone, it's Schematic Med, and today we're going to talk about management of non-traumatic acute back pain. Acute back pain is when pain is less than 4 to 6 weeks, and non-traumatic means that there is no history of trauma. The most important step is to assess if significant neurologic deficit is present. If it is present, we should do emergency MRI. For example, urinary retention, urinary incontinence, saddle anesthesia, lower extremity weakness involving multiple nerve roots, for example during cord compression. Again, if any of this is present, we should do emergency MRI. If none of these are present, we should assess for infection. The clinical signs of infection are fever, spinal tenderness, history of intravenous drug use, or immunosuppression. If infection is suspected, we can do MRI or we can consider X-ray with ESR and CRP examination. If we do not suspect infection, next step is to assess suspected malignancy. For example, if case presents current or recent cancer history, systemic symptoms, for example weight loss, or multiple cancer risk factors. If we suspect malignancy, we do MRI with ESR and CRP. If we don't suspect malignancy and we have uncomplicated back pain, we do not need imaging and we should continue pain management. Let's repeat one more time. Most patients with acute low back pain do not require imaging. However, spinal imaging is indicated for patients with significant neurologic deficits or clinical features suggesting increased risk for infection, malignancy, or bony abnormalities. The preferred test for patients with a history of malignancy is spinal MRI, which has high sensitivity for lytic bone lesions and metastasis in the surrounding soft tissues. As it is very important, I want us to repeat one more time high-risk features in back pain, and we need to consider MRI if any of the following is present. First, cauda equina syndrome with acute urinary retention and saddle anesthesia, epidural abscess or spinal infection with fever, immunosuppression, intravenous drug use history, malignancy with current or recent malignancy history and unexpected weight loss, and other factors like age, more than 50 years old, coagulopathy, focal spine tenderness, and severe bilateral progressive weakness. Thank you, bye.